Well, this is certainly troubling. Indiana's heading in the wrong direction when it comes to COVID-19.
So let's take a look now at the latest graphic here, and you can see that trend up on the right-hand side of your screen. For a second day in a row now, the state of Indiana reporting more than 2,000 new positive cases of COVID. We're talking 2,507 new cases added just today.
And we're seeing this trend all over the country right now, and the CDC does not think this is going to improve anytime soon.
The agency, in fact, predicts new COVID deaths and hospitalizations are going to continue to go up over the next 4 weeks, with 630,000 to 662,000 total deaths reported by September 4th.
Kids under the age of 12 cannot get a vaccine, so they are the most vulnerable as the Delta variant spreads.
And that's a big change from the first days of the pandemic, when it was the elderly who we kept saying were the most vulnerable. That's what all the experts were saying. And now Dr. Anthony Fauci explains this switch.
Relatively speaking, the young are now more vulnerable because they are in the cohort who's under-vaccinated, either children like 12 to 15, 12 to 18, who are eligible, who are not yet gotten vaccinated when they should, or the children who are too young to get vaccinated. So when you look anywhere in a hospital, you are seeing a relative proportion of people who are sick are leaning much more towards a younger group. And that's not surprising.
And we're starting to see the COVID effect on children here in central Indiana.
Rich Nye is in Brown County, where COVID cases have forced one school there to close just days into the start of the new school year.
The playground sat empty Wednesday at Helmsburg Elementary School. After just a week of classes, Brown County schools closed the building for 3 days due to multiple positive COVID-19 cases. All students.
It's sad that within the first couple of days of school that there were children that came to school that tested positive for COVID because maybe they had that before and they should have stayed home in general.
More than 60 of the roughly 300 students and staff at the school either have COVID, were traced as close contacts, or were absent with possible symptoms. That's 21.4% of the school population, above the 20% threshold, which the school district uses for a pivot to temporary remote learning. Helmsburg Elementary will be closed the rest of this week. The school building is undergoing a deep cleaning. All students and staff will return on Monday unless there are additional new positive COVID cases. Deidre Altop brought her daughter Lily to school to pick up a remote learning packet.
Did you like coming to school?
Yeah, it's so fun. Yeah.
Were you upset that they had to cancel school for a few days?
No, it's okay.
You'll be back on Monday, hopefully, right?
Mm-hmm.
Brown County reports a 7-day positivity rate under 4%, with over 52% of the eligible population vaccinated. Both numbers are better than the state average.
I think with this Delta variant starting to rear its ugly little head that we're seeing an increase in both testing and vaccination. So the good news is we're seeing an increase in the vaccination.
I hope that this break early on in the school year sets a pace and lets everyone know that it's still serious, that it's still a concern to a lot of people still out there, and that we got to take care of our kids.
Back to school on pause.
The superintendent says that right now no other Brown County schools are close to the threshold of facing a shutdown. The school district started the school year with mask optional, but then changed to mask required for everyone in all school buildings, and they made that change back on Monday. And you know, a whole southern Indiana school districts already going virtual for the new school year. We're talking about Scott County District 1. This district made the decision to move to remote learning today through August 23rd. The Scottsburg, Indiana districts had a high number of positive cases there and an extremely high rate of students who now are in quarantine.
Children across the country will be heading back to school soon, and the Centers for Disease Control and Prevention is recommending they wear masks. The recommendation was made in part because the COVID-19 vaccines are not yet authorized for children younger than 12 and the rise of the Delta variant. But that recommendation has some people wondering, is there a rise in COVID-19 cases among children? So let's verify. Our sources are AAP, the American Academy of Pediatrics, the Centers for Disease Control and Prevention, and Dr. Gabe Kellen, professor and chair at Johns Hopkins University Department of Emergency Medicine.
So the data are not fully in. but we are very concerned about the numbers of infections that we're seeing in children.
The definition of child varies by state, but the AAP says it typically means anyone 19 and younger. After declining in early summer, cases of COVID-19 in children steadily increased in July. According to the latest data from the AAP, 72,000 children tested positive for COVID-19 during the last week of July. That number is nearly double than the week before. The CDC says the increase in child cases coincides with a national spike that's tied to the spread of the Delta variant. In its weekly review on July 30th, the CDC said the 7-day average for new COVID-19 cases increased by 64% compared to the previous week. But a spokesperson for the AAP said it's too early to tell how the Delta variant is affecting children. In a statement to Verify, they said, "Right now, there is no data to show if the variant is more dangerous to children, and so it's premature for our experts to comment on it." So we can verify it is true. There is a rise in COVID-19 cases among children, though experts say not enough information yet exists to determine if the Delta variant is more dangerous to children. With your Verify, I'm Ariane Daytil. Want something verified? Email us or send us a text.
And a lot of you have been wanting to know more about this case in Mount Vernon. We do have more information, another Verify, that our team has been cranking out the data for you. You can watch it tonight on 13 News at 11.
Yeah, Bob Siegel's been looking into claims made by this doctor at the Mount Vernon Community School Board meeting. The video, as we've talked about many times, has gone viral. If you've had questions about what was said at this meeting, Bob has the answers for you. Again, watch us tonight, 13 News at 11. Well, the CDC is now urging all pregnant women to get vaccinated against COVID.
The CDC is strengthening its recommendation as it sees more pregnant women who are not vaccinated get seriously ill with a case of COVID. The CDC also recommends breastfeeding moms and women who are trying to get pregnant to go get vaccinated as well.
As of July 31st, only 23% of pregnant women had received at least one COVID shot.
And you know, we see these numbers go up and businesses are responding. In fact, even more businesses now are requiring their workers to get vaccinated. And one state's even going to require teachers to go get the COVID vaccine as well.
And all of these changes are happening as hospitals across our country are running out of beds. Tim Cotto has been at Kingwood Emergency Hospital since last Wednesday after being diagnosed with COVID and pneumonia. He needs urgent care, but the hospital is out of ICU beds.
As we're leaving, the nurse comes running out that he had gotten a bed in New Mexico. So we were so excited and we celebrated, but unfortunately since then, my husband has taken a turn for the worse.
As ICU beds run low nationwide, 45 states saw a rise in cases during the past week, according to Johns Hopkins University. As students head back to class, a new national survey from Kaiser Family Foundation shows 63% of parents want mask mandates at schools. 58% of parents with children aged 12 to 17 believe vaccines should not be required.
There's only one way to manage this, and that is to demand that everybody who's in a classroom is masked and that everyone who walks into that school who's vaccine eligible is vaccinated.
California teachers and other school staff will be required to be vaccinated against COVID or submit to regular testing under a new order by the state's governor.
We think this is the right thing to do, and we think this is a sustainable way to keeping our schools open.
And the Kentucky governor signed an executive order requiring masks in schools and daycare. As schools battle this issue, some businesses are trying to decide whether or not to mandate vaccines for employees. And we just learned today that Amtrak is going to soon require its workers to get the vaccine. They've got a deadline of November 1st, or they'll have to submit to weekly COVID testing. Beginning October 1st, all new Amtrak employees will have to show proof of vaccination before they start working.
And take a look at the problems that this COVID surge is causing in Texas. A rural hospital in northern Texas set these medical tents up outside the hospital. They've done so to handle the capacity. They have run out of ER beds inside. And the state of Texas is also setting up 5 rapid injection therapy centers to try and keep COVID patients out of the hospitals. They're going to give all of those patients Regeneron through an IV. Now, this is a treatment that uses antibodies to stimulate the immune system to better fight the infection. But not everyone is eligible for this treatment. Only people who fall into certain at-risk categories can get this treatment.